A picture's worth 1,000 words. Here's our slide. It's called Hey Big Spender. This is from the University of Alberta School of Business. There's healthcare spending right there. When you were told we need to privatize the system, they cut and slashed healthcare. Because of the decisions that were made, look at healthcare expenditures. We are the most privatized system in the nation in Alberta. Canada is the third most privatized system on the planet. The US is number 1. With Halbert Johnson, Gary Marr, Iris Evans, Dave Hancock, Ron Leipert, and Jean Wozdeski. The blue line is your healthcare spending curve, and our waits have gotten longer than ever. The red line is your education spending curve. What's at risk? Everything else. Who finds this acceptable? We're spending more than ever. This is fact and evidence. Obviously, we need to invest in roads, education, senior supports, our universities, many more important issues in society that actually keep you out of the prison system, out of the healthcare system, and off the streets and in your own homes. But right now, how many Albertans even know how much we're spending? Did you know that all the personal income tax and all the corporate tax combined in this province that the government collects at a time when almost every Albertan's working, we're spending more than that in healthcare. Did you know that? I want you to go and tell your family and friends about that. This is your money. How many more deficits do we need? We've had 4 or 5 deficit budgets in a row. There are 2 booms that we've blown. There is no option. We must fix the system. We simply can't afford to wait and watch as costs keep growing and care keeps getting worse. Part of the solution lies in providing affordable and properly staffed facilities for our seniors, especially long-term care. Good, affordable, community-based, non-profit, community-based lodges and community-based long-term care. Did you know that we have 777 seniors right now waiting in acute care beds? Right now. Homeless. They should be home in their own homes or in a facility that's appropriate for them. And they're with the wrong doctor and the wrong nurse in the wrong place for the wrong period of time at $1,600 a night. That in turn causes all the cancellations of all your surgeries. That's why your surgeries are being canceled and delayed. That in turn causes all of the emergency department waits. It's not the sore throats and runny noses causing the ER problem. Those people should have been upstairs 4 days ago. Instead, they're spending 4 days in the ER. You're actually sicker by the time you get upstairs. You got to get your sleep when you're sick. But when you spend 4 days with the wrong doctor, wrong nurse in the wrong place, you spend more time upstairs. And that's what's also causing the whole ambulance fleet of Alberta, the whole fleet of ambulances, to be waiting in ER departments, waiting to offload patients. And that's what red alerts mean. What red alerts are when there's no ambulance on the street to respond to a 911 call. And did you know that we've actually tripled up our ambulance fleet in the last 15 years in Edmonton? And they're doing 1/3 the number of trips? I ran into a mortician who said, Raj, I got to tell you something. I have met many widows who said, had the ambulance just got here in time, my husband would have lived. That's what happened when there's a red alert. The ambulance needs to get to you within 7 minutes. And have you heard about the private health care, private home care, long-term care for our seniors? That's what the new government policy is all about. It's for-profit private facilities being built outside of the town. We're removing our seniors from South Edmonton, into St. Albert, into Lamont, into Beggarville. That's what's happening. Then we're charging you a lot of money for it, because they said the seniors got a lot of money, so let's go grab it. That's what the assisted living policy and DL policy is all about. The problem with private long-term care is this. The operator needs to make a profit. They need to make money. How do they make money? Real simple. They take a patient who's not so sick. They have a care provider who's a lesser level care provider, and they give you lesser care. So those people seniors who cannot afford that private care end up at the Grey Nuns Hospital down the street. That is Union Long-Term Care Facility, seniors housing facility. And that's your money that the government is giving their private buddies who give big campaign donations to build facilities. They're getting your money. Acute care cannot function if seniors housing is not looked after. It's actually a seniors housing problem. Secondly, it's actually a home care problem. In fact, we provide so little home care. We only provide $5,000 worth of home care. And of that, it's all privatized. You used to get $5,000 worth of public non-profit home care, but now you're actually only getting $2,000 worth because they got to make $3,000 off you. So what happens is the private home care people bring people to emergency saying, sorry, home care, we can't look after this patient. They bring seniors to us in emergency, then they spend 200-300 days in the hospital. They're never going home. They're going to go to Lamont while their partner is in Millwoods. There is no public home care in Alberta. The fact that there are organizations like International Red Cross and the Victoria Order of Nurses, they're ready to start to give community-based non-profit home care tomorrow. But the government won't call them in. I had already talked to them. They don't want to call them in because there's no money to be made. It's community-based. The government doesn't want to build community-based lodges because there's no money to be made. Let's do what the Danish do. In Denmark, they give so much home care, you actually don't need long-term care. Did you know that? It's so much home care, you actually don't need long-term care. So if you really want to fix your emergency problem and your hips and knees and your surgery wait line problems, let's deal with our seniors. Let's get them world-class home care and community care. Now the real key to actually controlling costs and fixing the healthcare system is let's not get sick in the first place. Getting sick is actually what costs money. Let's not get sick in the first place. You should go to your family doc for a regular checkup. Address all your risk factors. It costs, doctor gets paid $30, that's it. If you don't get that check, you get so sick, it costs $1,600 a night when you end up in hospital for a week, and then you suffer a lot. In Canada, we have a crisis. We don't have enough family doctors. 15 to 20% of Albertans and Canadians do not have a family doctor. In certain communities, that number is 70%. That's what this nation needs to work on. It's the fact that we went from a system based on primary care to based on specialty care. It's the over-specialization of healthcare that's the problem. We need to base the system on primary care and prevention. And that's what the Europeans have done. They have so many family doctors, they actually come to your hotel room in France. That's why. It's not because of private healthcare and private insurance. They have so many of them, they got to earn a living. So they're going to come to where you are. There's something called the medical home model, where teams of healthcare providers work together, doctors, nurse practitioners, nurses, pharmacists. They give you so much home care in the community, so much health care in your community, they come to your home. That's what we need to base our system on, like we used to have years ago when the doctor came to your home. And guess what? It saves money. It saves money, and it's better for you. Who thinks that's a good idea?